Good afternoon, everyone. Am I audible? If somebody could give me a thumbs up about it.
Yes,
Yes, we are
ma'am.
audible.
Thank you so much, Niranjan. So, good afternoon, everyone. We are here today for our Friday's webinar session, which is part of our initiative, which we started referring Connect for Psychological Support. We are available on call for people who would like to connect with us, who would like to reach out to us. And the idea is to be a listening, hearing buddy for them. In the current scenario of COVID-19 that we are all into, these are hard times for all of us. And especially the topic that we are talking today, that is managing grief and loss. All of us have either had an experience of directly losing somebody that we have loved, or professionally known somebody, or at some or the other level, if we realize there's a loss which we all have experienced, and this definitely does affect our well-being. Therefore, we felt that it is essential to acknowledge and accept the loss and grieve the loss. And for today's session, we have our expert, Ms. Keshav Sharma, who will be essentially talking about managing grief and loss. I welcome you, Keshav, on behalf of GD Goenka University and School of Humanities and Social Sciences.
Thank you, Sakshi ma'am. Thank you so much. And it just feels very familiar to be in this group,
I'm
even though
sure.
many of the people in the current group. But yes, I can see Niharika, I can see you. So at least few people I already know, and it just looks like talking to a family again. Why I said family? Because when the association we've had, and it did feel like a family only, meeting these
Definitely.
children now and then and staying connected. That's what we need.
I
And from
agree. I agree.
connections, when we talk about grief, why we grieve is also because of our connections. You do not grieve something that you're not attached to. When we talk about grief, what do we grieve? When we lose something, we feel bad for something that we lost, right? And why will you feel bad for something that you lost, that you do not have any attachment with? Grief comes from the attachment. So before understanding what grief is, before understanding what the response of grief is and the types of grief and what we should or we should not be doing while somebody is grieving, it is very, very essential for us to understand where does it come from. It comes from the attachment. And those of you who are psychology students, you have already gone through the theories of attachment. And yes, if you are attached to something, to that thing only you grieve. And the grief, again, demystifying the myths about grief is, you do not only grieve the person you lose to death. When you graduate from your college, you spend 3-4 years there, you miss your college, you grieve that. Even before the farewell ceremonies that we do, most of us cry because we are grieving, because we have been attached and now we have to be away from them. Losing a job, losing a pet, uh, problems in the relationship, losing relationships, loss of dignity, loss of control on your own life. When you lose all these things, you grieve. And grief is not only to death. And when we talk about more on grief, grief is universal, grief is personal, and grief is a total human experience. And when I say it is a total human experience, it involves the physical, psychological, emotional, social, professional, spiritual aspects of one's life. So it has many aspects. It's a total human experience that one goes through. Talking about grief, I can, this being my one of my favorite topics, I can keep talking for hours on this since we have lack of time. I will request all of you, if you have any experiences or anything that you want to share, or any question that you feel that you need to know, like how do we go through this, because grief is one thing that all of us go through at one point of time. Either we have gone through, or we will go through, or we are going through right now. So like I said, grief is not only losing a human being to death, grief is also losing the attachment. When you attach to something, you lose it, you grieve. And what is the response to grief? What are the symptoms that you experience when you're grieving? Probably the physical symptoms as sleeplessness, insomnia, hypersomnia, loss of appetite. And these symptoms, what I'm going to explain, might mimic with or maybe similar to the symptoms of depression and the symptoms of anxiety, right? Restlessness, constant worry. Most of the time you want to cry, you feel sad, becomes difficult for you to move out of your bed. So response a person has after losing, after the detachment on emotional level from a situation, from a person, like you're forced to detach, basically, right? When you're forced to uh, detach from a person, job, thing, material, pet, situation, organization, you grieve. And the response that you have after that, all of you were in school first. When you left your school, how did you feel? Sometimes you still miss your school. Some of us don't. So you coped. Some of you have are in this situation, and most of you are sitting. All of us are sitting at home, and we are grieving our, going through the process that we miss our organization, the physical connection that we had with human beings. All of us are craving to meet human beings, right? That also is part of grief, because we want to do it, we can't do it, we have to be rational, we have to follow COVID appropriate behavior. That's grief. Grief is, everything goes through it. It is a total human experience. It affects on your physical level, it affects your psychological health, it affects your emotional health, it affects your social health, it affects your spiritual health, professional health, right? So this is all about grief in a very brief thing. uh, Most importantly, since we all of us go through this, I will not talk more on that, but most important part that I want to cover is, what are the things that you do or you don't do, or say or you don't say to a person who's grieving. Even though sometimes we want to be very empathetic, right? We are empathetic, we are compassionate, we are uh, social, we are connected, we have the, the belongingness to the person, but still we are, sometimes unknowingly we tend to say things that we shouldn't have. And often we have said few things, the person, we haven't gotten any response, and we did not realize it, but that thing the person has taken on another way. So I'll just give you one example from my yesterday's experience with one of my clients. So this client has, she lost her father few days ago, and the things that she was told by the loved ones, everybody in the family, that you have to be strong, you have to be strong, you have to be strong for other people. Do you think this person doesn't know that she has to be strong? She knows it. Probably she doesn't want to hear it again and again, because she was told quite often that she has to be strong. She felt it. She felt that her grief was not understood. People don't did not understand her pain. So often when we say, and we do these mistakes because we don't know. In grief is not a disorder. It is not a physical illness. It is not even a psychological illness. It is a process all of us go through. It is not a disorder. Only complicated grief you will see in our DSM-5 is one of the disorders category they have given, but that is complicated grief. That's not the simple grief. So the normal grief is normal. It is universal. It happens to everyone, individual, communities. And right now, as a community, we are grieving. So much is happening. So coming back, what you should or you should not. I don't know what you should do, but I want to share with you what you should not do. Never say a person who is grieving that you have to be strong. They know it. They don't want to hear it from the other person. They know deep inside. Never say a person that I understand. Like I said, even though you have gone through the similar grief you might have gone through, but when you say to the other person that I understand how it feels, I'm sorry, you do not. That person is different. It might just give you a setback, like, oh, how can I not? I am very, very empathetic, I'm very compassionate, I do understand, but I'm sorry, grief, you do not. What one person is going through, what one person is feeling, the other person cannot understand. The sibling even your sibling will not understand. Like, for example, this patient, she felt invalidated by her own siblings when they said, oh, we have to be strong. She didn't want to hear that. So the loss is same. Everybody has a different response to it. So what we avoid saying is, you have to be strong. No, they don't want. This is a very simple thing. Yes, it is, things that we want to say. But sometimes keeping a silence will work. You don't have to say necessarily. So listening is going to be a very, very strong tool for you when you are helping somebody who is grieving. Using minimal words. Avoid as much talking as you can while you are talking to someone who's grieving. I understand. Sorry, you do not. Avoid saying that you understand, right? Because it's different, because it's individual, it's different response, different, same age, same kind of loss, but still we cannot, it's absolutely unique. It's a unique experience that people go through. It's okay, it's going to be okay. No, it's not going to be okay. And grief, people often say, and I don't know how many of them do understand the saying that they say grief comes in waves. Yes, it comes in waves. But do we actually understand what does that mean? Grief will keep coming in waves. What will happen? It will never stop coming. You stand on a sea coast, stand on a beach, standing on the waves are coming. First time when you stand, it hits you, you fall. Second time when you again stand, it hits you, you shake, you lose your balance. Third time when it happens, you again lose a little bit of balance. Waves keep coming, but you learn to stand still. You become resilient because you accept, you have calculated the force it's coming up with. You have got an experience. So yes, grief comes with the waves, but what happens is it hits you with the same intensity, but you are resilient next time. First initial times you may not understand what is happening, or what do I do, how do I cope, but acceptance happens. Acceptance happens when you are standing still there. That's how grief comes in waves. Waves never stop coming, be it day or night. Waves are going to be there. You become resilient, you learn to cope, you know how you have to put your feet strong into the sand. So that's how things happen. Lot of things that we do not have to say, lots and lot of things that we do not have to say. More than learning what to say, there is no universal language, that there are no fixed sentences I can tell you, like, oh, this is what you tell to a person who's grieving. I'm sorry, I may not be able to. but I can definitely tell you what not to do. It's not okay. They have what they have gone through. It's difficult for them. They're always there. So people say, oh, you move on. Moving on is not easy, right? Is it easy? No. You and people say often people who are grieving the relationships. What do we say? When they move on to another relationship, they grieve. But if there is a relation, the attachment in the previous relationship, you will never forget that. But yes, you will cope well in the next relationship. So grief in the time of pandemic, if we talk, it is intense. It's the world is full of grief. The world is grieving. There is so much grief. What are we doing? We stay mindful. We stay compassionate. We use less words.
Ma'am,
So yes, if you have any questions, please I keep it open for you. Please feel free to ask any question, any concern, anything that you don't agree or don't agree with me. So yes, it's open to you all. Thank you.
हाँ मैम, एक्चुअली अपना पास्ट कैसे बोलें जो आपसे अपने पास्ट में गलती हुई हैं?
पास्ट कैसे भूलेंगे?
यस मैम।
Can you just elaborate? थोड़ा सा मुझे समझाओगे? In what sense you are saying? Past में जो गलती, see, past mistakes सारे लोग करते हैं,
यस
गलती हम
मैम।
सबसे,
अदर
है ना?
मैम उधर, अदर वो गलती ज्यादा ही बड़ी हो, अपनी हेल्थ पे भी बात आ जाए गलती से, तो क्या फायदा ना। तो अब वो चीजें रिग्रेक्ट हो रही थी भाई, हाँ हमने ऐसा क्यों करा, इनके साथ क्यों किया हमने, राइट ना मैम। तो
या
हाउ, अब हमारी मेरी स्टडी भी इफेक्ट हो रही है इस वजह से, मैं पढ़ भी नहीं पा रहा हूँ। मेरे मन में वो आती रहती है बात भाई, हाँ मैंने क्यों करी यार, वो चीज क्यों करी मैंने, बहुत रिग्रेट हो रहा है मुझे, और मैं
yes.
भूल नहीं पा रहा वो चीज बिल्कुल भी मैम।
So what we do here is become resilient. बहुत बड़ा वर्ड है resilient, पता नहीं है कैसे होना है. There are 5 things that you can practice to become resilient. जो गलतियां हो गई हैं. Can you change anything? पीछे वापस में जाके टाइम मशीन में बैठ के वापस जाके गलती ठीक कर सकते हैं?
नो
नहीं कर
मैम।
सकते. Not possible, right? That's the science fiction only. Real world में नहीं होता है. What you can do is accept the fact, accept now. There is आपने एक्सटर्नल लोकस ऑफ कंट्रोल और इंटरनल लोकस ऑफ कंट्रोल के बारे में सुना होगा.
यस
So
मैम।
there are things that you cannot change. So you don't think much about it because आप कर ही नहीं सकते. अब पेंडेमिक है, हम कुछ नहीं कर सकते उसके लिए. But what I can do in this is keep myself. I will keep following the COVID appropriate behavior. That is what will save me. And your question that जो पास्ट में गलतियां हुई हैं उसकी वजह से हमें बार बार चिंता हो रही है, ये हमसे क्यों हुआ. बट अब ये सोचो कि उसके बारे में सोच सोच के अभी कुछ फायदा हो रहा है. इज इट हेल्पिंग यू? इट्स नॉट. ये आपको चिंता दे रहा है, ये आपको और परेशान कर रहा है. सो व्हाट यू डू ओवर हियर इज एक्सेप्ट, forgive. I'll give you one example. Forgiveness, how do we practice forgiveness and compassion? If you're, अगर आपके किसी दोस्त से ये सेम गलतियां हुई होती, अगर आपका कोई फ्रेंड है और वो कह रहा है कि मुझसे ये सब हुआ है बचपन में और मुझे ये नहीं करना चाहिए, तो अब मुझे बहुत चिंता हो रही है. What will you tell to this friend? It's okay, it's past, forgive. हो जाती हैं, राइट? या आप ये बोलोगे कि नहीं तुमने करी तो करी कैसे, ऐसे कैसे होगी? We often become very very suggestive to other people because हम compassionate होते हैं. हमें उस टाइम लगता है कि ये हो सकता है, माफ कर सकते हैं. Why not to practice those skills that you give other people to your own self? अगर हमारे किसी फ्रेंड, अगर ये आपका कोई फ्रेंड होता तो आप उसको यही बोलते कि इट्स ओके, चीजें निकल गई हैं, खुद को माफ कर देते हैं, पास्ट में जाके चेंज नहीं कर सकते, अभी भी फोकस करते हैं. So look at yourself as a second person. See how the kind of suggestions you will give to this person, and this will help. And understand, you cannot go back to past and correct. What you can do is now, correct now, make changes now. Life starts from now, right? Life starts from today. Change happens from today. Do we have any other questions around grief? How do we deal?
That
Concerns?
I
Yeah.
would just like to request the participants to type their questions in the chat box and keep themselves on mute so that everybody can hear us well. Right? Any questions, please?
Adya says a lot of humans don't fully recover or process grief from childhood on a subconscious level. The pain doesn't go away that easy. And this is my experience impact every relationship we have since. Okay. Can you talk about how, as adults, we should connect with our inner child and heal that event? Uh, Talking about grief, like I said, I gave the example of waves. You never get over your grief. That might sound like a bad news. You never get over your grief. You don't forgive. You don't forget the person. If you are grieving a human being, a person, a loved one, you will never get over their memories. Frankly saying, you don't even want to do that. You want to keep them in your memories. You want to keep talking about them, thinking about them, right? If it's a loved one, you have, you know, the childhood, the trauma, and maybe not the trauma, but the grief that you experience as a child, it will always be there. The grief that you're experiencing now, it will always be there. You don't forget. There is no switch and switch off. What you do is you become resilient. How do you become resilient? Be grateful. Practice gratitude. Keep practicing gratitude, not daily basis, but at least weekly basis. Do the gratitude journaling. Practice gratitude. Practice compassion. You're all very, very compassionate. And this time has proven us. It has shown us a mirror that we are all compassionate deep inside. We have been an example how the proof has been there that all of us are compassionate. Everybody has helped everybody without knowing who they are helping. The community has just been right out just to be available. Somebody has come, reached out to you for help. If it is in your capacity, you did not think of their gender, your age, their any background. You were just right there to help them. Practice compassion, practice gratitude, find meaning in things that you do. How do we find meaning? When you do something, you help someone, you like it, you feel okay, I found meaning, this is what I feel doing good. You take care of a plant, you find meaning that, oh, I'm contributing to the environment. You help a pet, you do good for other people, that's how you find meaning. You read a book, you feel so fulfilled, that's how you find meaning. Find different things that you help yourself find meaning. So finding meaning, third part. Practice forgiveness. Like I said, we forgive other people very easily. We tell other people it's okay, you can forgive, right? It happened in the past, you can forgive yourself too. When you practice these 4 5 things: gratitude, compassion, forgiveness, meaning, acceptance, accept what it is. These 5 things, if you keep practicing, you become resilient and you will be able to deal with your, uh, I say deal and cope, not get over your past. You will not get over your past. It again sound like a very harsh and very uh, sad that how can I not forget? But you don't want to forget the memories of your loved ones. You want to keep them in your life throughout. So practice these 5 things. They will make you feel. They'll make you more resilient, and life will become easier. Acceptance. Acceptance doesn't come just like that. And when we talk about grief, we often talk about 5 stages of Elizabeth Kubler-Ross. Just a reminder: the 5 stages: denial, anger, bargaining, depression, acceptance. She said acceptance comes in the end. Sometimes because it happened in 1969, that's when she came up with the theory. But today, acceptance, these stages of grief keep shuffling. You might just accept right away. First step to your grief may be the acceptance, but you might get little angry or like be into denial, like how can this happen? Can something make it, change? So we go through all these stages one or the other time. The stages may repeat, they will be to and fro. It doesn't have a sequence. That first you will be in the denial, then you will get angry. It's not a step by step procedure, it's very shuffly. You feel anything anytime. But when you practice these 5 things to become resilient, I repeat, gratitude, acceptance, forgiveness, meaning, compassion, you will be able to make your life easier and be able to cope and deal with the grief that you're going through. Do we have more questions? I simply wanted this to be interactive, but yes, I see people don't want to talk, but this can be your personal experience and concerns that you can share and you can get help with. Yeah.
Keshav, ma'am, there's another question actually. Someone saying that if we lose somebody in family and the person is living alone, how can we help them as a support system?
So this time also has been that we are all in the separate places, right? How do you support? You just be there. And one thing that you can do to help a person who's grieving is just be available, just be there. You don't have to say that anything. You don't have to keep saying that I'm there. You don't have to keep saying talk to me. Just be there. Keep your availability, keep yourself available always, with your own comfort too. Keep yourself available. If and when they want to talk, they will have someone to reach out to. There is not much you can do in helping other people. People heal on their own. The healing happens on their own. Also remember, grief doesn't have a time period. It is not that, if you lost somebody, say 15 years ago, so you should not be grieving. There is no protocol like that. Grief is a process. It can take days, months, years, ages. You don't get over grief just like that. And we don't want to get over also, especially the loss of loved one. It takes time. It is a process. How you can help other people? Just being available. Be there for them. Be the support system. That's it. That's all you can do. In distance, in physical, in a physical presence, that's all you can do, because we have to also consider the current situation. This is what we have, and we keep doing. I will not talk anything unpractical like, oh, you go and be there. No, if there is a situation, you can't go there. But yes, you can connect through the, if they are able to connect, you can connect through the phone video, do the video calls. Check with them if they are comfortable doing it. Keep checking with them. Check with their physical health. Help them with their physical health. Remind them that they have to eat, take rest. It might be difficult. And also keep giving them a very, decent reminder, so that it doesn't look very pushy, that you're being very, very intrusive. Just keep reminding them that you are there. Anytime they want to talk, you're going to be there. That's all you can do.
Thank you, Keshav. I think I will just take this last question, where one of the participants has shared that she has lost her grandfather. And she says it's been a month, but it is very difficult, especially because she definitely misses him a lot. And usually in the day, she's busy and occupied, but as the day comes to an end, she suddenly feels more of a rush of her emotions and feels uneasy and tends to have a breakdown after every 3 or 4 days. So she just wants to ask that how can she cope with this?
What you're feeling is normal. It's not a problem. This is how the more we are attached, the more we grieve. The intensity of the attachment will show how will also that's how intense your grief will be. So the fact that you miss her during the day, yes, we keep ourselves occupied. Evenings become very difficult because it's getting darker. There is fear on subconscious level. What you can do is talk to someone about it. Talk about it if you feel comfortable. Journal about it. Do the journaling. That helps. Because when you're missing somebody, so you tend to have that monologue in your head that this is, you know, this is how you talk to them in your head. Put it on a paper, put it on your phone notes. You want to keep the record, keep it. You want to delete it after a while, do it. But take it out of your system. Crying is good. You tend to have breakdown after 3-4 days. It's healthy right now because there's so much void that is building up inside. It has to come out. You have to offload yourself. And this is the offloading happening. Talking to someone, journaling, make sure that you are taking your meals on time. Make sure you're trying to take rest. Whenever the thoughts, and in the time of grief, we feel very sad. It disrupts with our sleep cycles. What do we do? But still, we need to take the rest also. Try practicing mindfulness. And mindfulness is not something like sitting in a samadhi pose for an hour or two and keep focusing on something. You don't have to focus on anything. It's normal when you go to sleep, lie down. You tend to get a lot of intrusive, negative, automatic thoughts. They disrupt, they affect your sleep. So, what you do before you go to sleep, lie down. You will get thoughts. Let them come. Don't stop any of the thoughts. Let them come. Focus on the breathing. How do you do that? Focus, breathe in, breathe slowly in on the count of six. Slowly, 1, 2, 3, 4, 5, 6. Hold for 3 seconds. And then exhale with the same speed of the count of six. Keep repeating it. Once you are focusing on this, imagine the oxygen getting inside your system, converting into the carbon dioxide and coming out. Imagine the negative thoughts or negativity that you feel inside your body coming out through the when you exhale. That helps. And also when you focus on your breathing, thoughts will keep coming. What you do, you don't focus on them. You let them come, but you remind yourself this is where you have to focus. It's very simple, like you have an assignment tomorrow, right? You have an very important assignment tomorrow. You have to study for that. There will be a lot of distractions. Somebody is saying there is something on the Instagram. Somebody said, oh, new show has come up, new movie has come up, a friend is calling, this, that, so many things. Do you get distracted? No. You bring your focus on the preparation of the assignments. That's how you are able to score. This is what you do with your mindfulness. When you breathe in, bring your attention, let those thoughts come. You don't have to stop them, because when you keep fighting them, you're engaging in that. It also is taking your time. So when you are breathing, thoughts are coming. You again remind yourself, this is where I have to focus. Keep bringing your focus back on the breathing. Repeat it 8 to 10 times. And I'm sure you will fall asleep before the 8 to 10 times. Keep practicing mindfulness. Another technique, a very small thing about mindfulness is all of us drink water. All of us breathe. All of us eat. But do we ever know, or have you ever realized how does it feel inside your mouth? What is the texture of water? Or what is the texture of roti and whatever food that you eat? We eat mindlessly. So again, you don't have to spend hours. You just have to spend maybe 30 seconds, 10 seconds. You're thirsty, take a sip of water. Keep it in your mouth for 2 3 seconds. Feel the temperature of the water changing inside your mouth, and feel when you swallow it down. That's mindfulness. Mindfulness, it's not, it sounds very uh, high funda, very fancy term. It's as basic as this: eating, breathing, drinking. That's how it is. Keep practicing, this will help you. And the person who asked about the grief, this is what you practice. Thoughts will come, talk to someone, offload. Crying is happening, and it's normal, it's absolutely normal, right? Accept the thoughts, accept what you're feeling. That's it. And if you really feel that it's still not helping, reach out, talk to a professional, reach out to someone. And remember, there is always help available. There's always help available. If you feel that you are going through a very bad phase, that time if you feel that, oh, nobody is there to talk to, don't. When you are in a good mood, make a list of people you can reach out to. And remember, when you are in good mood, make the list of people that you can reach out to. And whenever you are on the other side of the other spectrum of the emotions, check that list, call them, reach out, feel good. Thank you. Do we have more questions, Sakshi ma'am?
Thank you so much, Keshav. I think these were the questions that they have. I think you have actually addressed them all while you talked about how do we take care of the past sometimes because we unnecessarily overthink. You've talked to us about being more aware, being more mindful, actually practicing gratitude. And these are some very basic essentials that I'm sure if we all do follow, we will definitely benefit. So thank you so much for this lovely brief session, Keshav. I'm sure many questions have, not even asked though, but have got answered simply because it's sometimes hard to talk about grief. But I think you put it very simply. Thank you so much for your time. And it was a wonderful session. I would now like to, and one of our students is actually, they all are saying thanks to you for your responses. And one of the students is also saying, ma'am, it was an amazing session that has been organized. Thank you so much. So thanks from our side. It was really lovely to have you today on board. And like you said in the beginning, the relationship that we have had has been quite long, and I would look forward to keep continuing the bond that we share with you and the Fortis Healthcare. So thank you so much. Yet I would like Dr. Midha to address you, and I would request Dr. Midha to give a thanks on behalf of GD Goenka and for this session today. We have Anjali, ma'am.
Yeah, thank you. Thank you, Sakshi. And sorry, I got cut off because of a internet issue. Thank you so much, Keshav. This was indeed, I'm sure, a very, very helpful session for our students and others that are attending because there are a lot of unresolved issues. There are a lot of problems that almost everybody faces, but usually what one feels is that I'm the only one going through it. So, thank you so much for addressing questions that were asked and also addressing the ones that were not asked. Thank you so much. I'd like to also thank Fortis Healthcare for this session today, and thank you so much for being here with us today.
Thank you, ma'am. Thank you so much for having me here. And I think this is what we can contribute from our side, being mental health professionals, because we have been talking about, and I mean it, that together we can. We have to do the virtual hand holding for each other. And yeah, so we are holding hands, and yes, together we can. Thank you so much.
Yeah. Thanks all. And thank you everybody for attending this session. And also, as a closing comment, I'd just like you all to remember the last thing that Keshav said before she ended the session, that is, Please remember there is always help available. There is somebody that you can always reach out to. All the best, everyone. Thank you.